If you're over 40 and planning a pregnancy, sooner or later you may find yourself asking a difficult question. Should you keep trying to conceive naturally? Or is it better not to lose time and move directly to assisted reproductive technologies, such as IVF? In reality, modern medicine approaches this question a little differently. The key issue isn't which option feels more appealing or less intimidating. Personal preferences take a back seat. What matters most is identifying the approach that is most likely to give you the best chance of becoming pregnant. Not a guaranteed chance, but potentially a higher one. That's exactly what we'll be talking about today. Pregnancy after 40 is still possible. For many women, natural conception remains a realistic option. At the same time, the window for making decisions gradually becomes smaller with age. Reproductive potential continues to decline. That means the cost of choosing the wrong approach becomes higher. Time passes, and at this stage of life, time is one of your most valuable resources. That's why relying on guesswork is no longer the best approach. Choosing between natural conception and assisted reproductive technologies isn't a matter of personal preference, and it isn't something you can figure out by intuition alone. A woman's chances of becoming pregnant are influenced by many different factors. Without medical evaluation and the appropriate expertise, it's almost impossible to take all of them into account. At the same time, there is no universal answer to the question, what's better? Continuing to try naturally or moving on to assisted reproductive technologies? For some women, continuing natural attempts is still the best strategy. For others, the more rational approach may be to see a fertility specialist sooner and consider assisted reproductive technologies. After 40, achieving pregnancy is no longer just a biological challenge. It's a medical one. The goal is to choose the strategy that offers the highest possible chance of pregnancy in your individual situation. Why does time matter so much? The reason is simple. Reproductive potential does not stay the same over time. It gradually declines. As women age, ovarian reserve decreases, egg quality declines, the chances of conception become lower. These changes happen gradually rather than all at once, but they continue over time. That's why time becomes such an important factor when planning a pregnancy after 40. This doesn't mean that every attempt should result in pregnancy, or that your strategy needs to change after just 1 or 2 months without success. However, if the approach you've chosen isn't the right one for your individual situation, time can begin to work against you. Let's imagine an example. After a medical evaluation, a 43-year-old woman learns that her chances of conceiving naturally are relatively low. They are not zero, but they are low. At the same time, her chances of becoming pregnant through IVF are estimated to be potentially higher. Does that mean she should stop trying to conceive naturally? That's ultimately a personal decision. From a purely practical perspective, however, continuing natural attempts may not always be the most effective strategy. Reproductive potential continues to decline over time. If pregnancy doesn't occur within the next year, the chances are likely to become even lower. And that applies to IVF as well. The likelihood of success also declines with age. At the same time, IVF and other assisted reproductive technologies are not a cure-all. Once again, we're talking about probabilities, not guarantees. In some situations, those probabilities may simply be higher than they are with natural conception. There's another important point to remember. In the previous video, we talked about pregnancy statistics. For women between the ages of 40 and 44, the average chance of conceiving naturally is about 5% per menstrual cycle. The average chance of pregnancy after a single IVF treatment cycle is around 10% to 15%. But these numbers shouldn't be compared too simplistically. A natural conception rate of 5% refers to every menstrual cycle. That means the chance accumulates over multiple months of trying. IVF, on the other hand, involves a single treatment cycle. It's also an expensive medical procedure that places a physical burden on the body. If the first cycle is unsuccessful, treatment may continue, but repeating IVF cycle after cycle without interruption is usually not the preferred approach. In many cases, fertility specialists recommend waiting 2 or 3 months before the next cycle. This is why decisions shouldn't be based only on the chance of success in a single month or after a single IVF cycle. They should be based on the strategy that offers the best overall chance of pregnancy over a meaningful period of time, whether that's 4, 6, or 12 months. That strategy should also take into account your exact age, the condition of your reproductive system, and many other factors, including treatment costs and potential health risks. What seems like the obvious choice after a quick comparison isn't always the best approach. That's why medical guidance is so important. When evaluating women over 40, doctors aren't simply trying to answer the question, is pregnancy possible? In many cases, it is. Their goal is to identify, as early as possible, the strategy that is most likely to be effective for that individual woman. In other words, the goal isn't to avoid losing time at any cost. The real goal is to avoid losing time by following a strategy that was never the right one for you in the first place. When is natural conception a reasonable strategy, and when should you consider ART? After everything we've discussed so far, a perfectly reasonable question arises. How do you know which approach is right for you? Should you continue trying to conceive naturally, or is it time to consider assisted reproductive technologies? Unfortunately, there is no universal answer. You may come across advice such as, if your ovarian reserve is low, you should move straight to IVF, or if you're still ovulating, keep trying naturally. But real-life clinical decision-making is much more complex than that. Imagine a woman whose test results look almost ideal. Her lab work is reassuring, she continues to ovulate, and her age alone does not rule out a natural pregnancy. At first glance, continuing to try naturally seems like a perfectly reasonable strategy. But during a more comprehensive evaluation, a factor may be identified that makes natural conception extremely unlikely. In that situation, continuing to wait would simply mean losing valuable time. The opposite situation is also possible. Some test results may look far from ideal, creating the impression that assisted reproductive technologies are the only realistic option. But after evaluating the full clinical picture, a fertility specialist may conclude that natural conception is still a realistic possibility, and in fact, the most appropriate strategy. In that case, there may be no real benefit to IVF, even though some individual findings initially appeared to support it. That's why making these decisions based only on your age, a few test results, or advice from the internet is rarely successful. Reproductive medicine doesn't work like a simple checklist where one finding automatically determines the next step. A doctor's job is not to recommend IVF, or on the other hand, to persuade you to keep trying naturally. The goal is to evaluate the complete clinical picture and choose the strategy that is most likely to lead to pregnancy in your individual situation. Why you shouldn't make this decision without a doctor? At this point, you may be wondering, with so much medical information available today, is it possible to evaluate your situation on your own and make the right decision? In most cases, that's extremely difficult. The problem isn't a lack of information. If anything, it's the opposite. There are research studies, clinical guidelines, advice from the internet, and stories from other women. But having access to all that information doesn't automatically help you choose the right strategy. More often, it creates confusion. The real challenge is the sheer amount of information that has to be considered. A doctor doesn't evaluate just one or two factors, but the way many different factors interact. Each factor can influence the importance of another. In some situations, natural conception remains a perfectly reasonable strategy. In others, the chances become much lower, making a different approach more appropriate. Even reading medical literature very carefully isn't enough to make this decision on your own. It's not enough to gather information. That information has to be interpreted as part of a larger clinical picture and applied to your individual situation, not considered in isolation. There's another important point. Choosing a strategy isn't a one-time decision. Even if the initial plan is appropriate, your doctor continues to monitor your situation over time. If necessary, the strategy can be adjusted. Sometimes it becomes clear that natural conception isn't progressing as expected, even though that was initially the most reasonable approach. In that case, it may be time to consider other options. In other situations, there may still be no reason to move to assisted reproductive technologies. This approach helps avoid one of the most common mistakes, losing valuable time by continuing with a strategy that either was never optimal or has stopped being the best option as the situation has changed. So, what does a doctor actually evaluate when choosing a strategy? Age, the results of medical evaluation, ovarian reserve, whether ovulation is occurring, the condition of the reproductive system, the reproductive health of the male partner, and many other factors. But most importantly, it's not the individual findings that matter. It's how they fit together. In a separate video, we'll take a closer look at which tests are actually useful when making these decisions, and why no single test can provide the complete answer. After everything we've discussed, it may be tempting to look for a simple rule. For example, after a certain age, IVF is always the better option. Or on the contrary, that natural conception should always be tried first. But modern medicine doesn't offer recommendations like that. The reason is simple. The human body isn't built from a single blueprint. Even women of the same age can have very different reproductive systems, and the combination of factors that influences the chances of pregnancy is almost never exactly the same from one woman to another. That's why there is no universal strategy that works for everyone. There is only one general recommendation. Don't look for a universal answer. Look for the strategy that is most appropriate for your individual situation.